Hello dear patients, today we are going to review the case of Ureaplasma parvum in a man. A young man came to us with reddening of urethral lips. He had a constant sexual partner and she had no complaints. However, after intimate life with her without a condom, reddenings of urethral lips appeared. Small discharges, burning and itch in the canal appeared. You can see them on the picture. Analyses for all sexually transmitted infections were taken. Culture test for bacteria was taken, as well as smear test for inflammation, smear test for flora. What was the result? As a result, only Ureaplasma parvum was found. There were no other causative agents. In bacterial culture test, there was no atypical microflora and leukocytes were 15 to 25. This indicates an inflammation of urethra, in particular, to which Ureaplasma parvum lead. Some people also recommend to check proportion of Ureaplasma parvum to a unit of cells, saying that if there are more than 10 to 4th power, then you should or shouldn't treat. However, if one of sexual partners is bothered by it and if it induces significant inflammation as in our case, then there is no sense to check proportion. If the problem is there and it bothers, then it should be treated. I am not a proponent of arguing for necessity of treatment, particularly if it's about childbirth or complaints. In this case, as inflammation was present, there were no talks about the necessity of treatment. Analyses were also taken from sexual partner, where Ureaplasma parvum was also found. Culture test for Ureaplasma parvum was taken with determination of sensitivity to antibiotics. As a result, a classic treatment of Ureaplasma parvum was done in this man. These are instillations, antibiotics, immune medications. So a course of treatment was done, and after that, in about 5-7 days, the complaints disappeared. In 3 weeks' time, a control analysis was taken for what was bothering, that is Ureaplasma parvum and leukocytosis. Both of these events resolved. Ureaplasma was not found and leukocytosis was 2 to 5 within a visual field, which is quite a normal dynamics after treatment. So Ureaplasma parvum is often underestimated, particularly among men. It often induces chronization of the process, and according to my observations, it speeds up the development of prostatitis. In some cases, it's prostate adenoma and presence of chronic inflammation that men often do not note, and even lesions of testicles, such as orchitis or epididymitis in some cases, are due to Ureaplasma parvum. So it's necessary to examine yourself and your sexual partners, and it's better not to have even potentially pathogenic flora in your body. If it's necessary to diagnose and treat any sexually transmitted infections, including Ureaplasma, you can consult venerologists, urologists, and gynecologists of our paid medical center of the Dermatov Neurologic Dispensary in Moscow. We have experienced specialists for the diagnostics and treatment of such infections. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.